control causing helplessness, can we anticipate something to regain control? And the answer is yeah. The research does show that if we can anticipate something, it gives us a sense of control, it gives us a sense of expectation, it can give us a sense of hope. So what parts of the brain might be doing that for us, right? When we talk about mental health, I hope that 5 years from now, we recognize mental health, neurological health, it's all just the brain, right? It's brain health. The name of this talk is depression in your head. Yeah, depression is in your head. Your brain's in your head. And depression is a brain-based condition. Your memories, stored in your brain. Your moods, your emotions, created out of neural networks. So when we're looking at anticipating to gain control, to regain a feeling of hope, we're looking at the prefrontal cortex, medial and lateral. So the prefrontal cortex is pretty interesting. They've actually shown that in people with major depressive disorder, this prefrontal cortex becomes less metabolically active. So the part of your brain that when it's active, it makes you feel like you have control, helps you feel like you have hope. Well, for people in depression, the part of the brain's not even asking to get fueled up the way it should. It's not asking for as much blood flow. It's not getting as much electrical stimulation. It's not responding the way it needs to. And then when we're looking at left versus right, medial versus lateral, there's been a lot of research that shows that it's specifically that left frontal. And we'll come back to that, but left frontal, left prefrontal cortex, left dorsolateral prefrontal cortex is a hot spot when we're talking about depression care. We also know that the temporal lobe, right? Temporal lobe is going to be auditory cortex for our memory processing, a little bit of language, but that the temporal lobe is also one of the regions that we'll see signs of with depression. Occipital cortex, the back of the brain. Now this is where we're looking at visual components. You'll get a lot of extra activity here with PTSD, but they'll say that parietal, occipital regions, in terms of the brainwave activity, will be different in people that have depressive disorders. Oh, how would we know that unless we measured it, right? So we can map the brain. It's not invasive. It's not like an MRI where it's super loud or it takes an hour. It's just putting a wet, a cap on someone's head, filling it up with gel. And then for me, at my practice, I use 19 spots on the head. Each spot is recording the electrical activity under that electrode. And based on the electrical activity and the angle of that electrical activity as it hits that electrode, we can start looking at these different, deeper brain structures. And after looking at all those squiggles, each squiggle is a different brain region, and then based on the frequency of the squiggles, we can start saying the brainwave activity. We'll end up getting a map, and we'll say, for this patient here, you have increased theta, increased frontal alpha. You have these little hot spots of increased high beta. And all of those can go into a treatment plan to customize care utilizing different neuromodulation techniques. One of those techniques that is FDA approved is neurofeedback. And it's actually been FDA approved for depression and anxiety and sleep issues and ADHD and OCD. Who here uses neurofeedback in their practice? Who here's heard of neurofeedback? Okay, at least there's some hands on that one. Good. But isn't it interesting that no one raised their hands when we asked who uses neurofeedback in their practice? But it's an FDA approved method to treat depression, anxiety, OCD, and ADHD that doesn't involve any drugs, doesn't involve any surgery, doesn't involve ECT. It's feedback, which is great. So for my kiddos, or adults, they just sit there and they control a screen with their brain. How fun is that? I put a cap on their head, the cap reads their brainwave activity, reads their electrical activity, and every time they're trending towards healthy, screen stays lit, they get to watch YouTube, Netflix. Anytime their brain starts triggering these poor pathways, these pathways that are deregulated, dysfunctional, the screen will shut off, or the music will fade away, or the game they're playing will lose. And the brain will figure it out. The brain wants to get rewarded with this YouTube time, with this Netflix time, with this game, or this music. And then every time the brain figures out how to get the screen back on, a little hit of dopamine, little neuroplasticity is taking place. We're rewarding the brain for being in these healthy brainwave patterns. And over time, we can start strengthening these brainwave patterns so that they can help heal or improve some of these networks. So these are the different brainwaves that we look at. We have slow brainwave activity, and every brain, there's not an unhealthy brainwave. It's all about amounts, locations. When you're sleeping, you want delta, but you really shouldn't have too much of it when you're awake, or you'll get foggy. You'll have memory issues. Beta, high beta makes sense. You're problem solving, you're awake, you're engaged. But if you're resting and your beta or high beta super elevated, is it because you're having racing thoughts? Are you ruminating? Are you having flashbacks? So neurofeedback training used for alpha and theta and inhibiting beta has been shown to have significant improvements in depression. And this isn't my research. I'm just sharing with you some of the research I've read throughout the years and letting you know is an option, right? I feel like I have heard this. I don't know. Maybe you guys have too. Has anyone in the last month heard someone say, I want to get treatment, but I don't want medications? I feel like earlier on in my career, I've been doing this 8 years, like earlier on, people are, I want to try without meds, but I'm happy with meds. I feel like every single year I've been in practice, I get more and more people. I don't want meds, I don't want meds, I don't want meds. Meds do help some people, but they're definitely not going to help people that are refusing to take them. Right? So being able to give them a different treatment option that's been proven to be safe, that has low to no side effects, and that's drug-free. There's another one, and this is going to be a small tangent. So there's less research on the next thing I'm about to say, but there has been some research indicating the influence of neuroinflammation on depression. So neuroinflammation is inflammation of the brain. Really bad inflammation of the brain obviously can cause comas and things like that. But the thought is that there might be some small underlying inflammation that is making healing harder. So this study here looked at a review of neuroinflammation in the brain, and it did say that there's crosstalk between the neuroinflammation and other relevant neurobiological components of depression. So the next thought would be, what are some therapeutic targets for future therapeutic strategies? Well, what if we could just decrease inflammation, right? There are some people out there that do feel better mentally when they take ibuprofen. But if I'm in the realm that I'm in where I can't prescribe meds, and I'm only using technology to help people get better, there is a technology out there. It's called hyperbaric oxygen therapy. You lay in a chamber, you breathe in oxygen, we pressurize the air around you, and just like they can pressurize the carbonation in your soda so that your water's all bubbly, your pop's all bubbly, you can pressurize someone when they're breathing in oxygen so that the oxygen just dissolves in the liquid portions of them instead of having to be attached to red blood cells. And all that extra oxygen can help with inflammation. Hyperbaric oxygen doesn't just help with inflammation, although you can see the inflammation alleviation. It also helps with antioxidants, suppression of some negative aspects regarding cells and aging, helps with creating new blood vessels called angiogenesis, new synapses called synaptogenesis, and new neurons called neurogenesis. And also activates stem cells. I mean, which of those sounds bad, right? The downside is that it takes time. It's not a quick treatment. It takes an hour to 2 hours in the chamber. And similar to neurofeedback, it's not a flip of a switch. It takes repetition. But how many people are getting their patients all the way better with one counseling session? Right? We know that healing takes time. We know that neuroplasticity takes repetition. But this is one thing to consider, especially if your patient is depressed and has chronic pain, has MDD and an autoimmune disease. Right? So when inflammation might be something you're thinking of, here's another drug-free, surgery-free option to decrease that inflammation. And there was a pretty crazy study. They did a study utilizing people with spinal cord injuries. And I do think I like where they went with it. I do think there's another step to go with this, but they did hyperbaric oxygen and they compared it to counseling, mental health counseling, talk therapy. And they said that it was similar. The effects on depression were similar in both groups. The one that did HBOT only and the one that did counseling only. I would say, why don't we take it a step further and do both, right? There's no need to compare and contrast when we have the ability to do both treatments. Get a question?
So who is funding hyperbaric oxygen therapy? How's it paid for? What's the cost? And who's the provider?
So his question was regarding funding hyperbaric oxygen, the research or the treatment?
The treatment.
The treatment. A lot of HBOT is cash pay. You know, that is one of the downsides. There are 11 conditions that insurance companies will pay for, but none of them are mental health related. In terms of who's doing it, there are tons of places these days that offer mild hyperbaric oxygen, where it's a soft chamber and they pressurize you to 1.35 atmospheres or 4.1 psi, which is the pressure you get when you're about 10 to 15 feet underwater. There are some other clinics that have much more intense hyperbaric chambers where they can pressurize you as if you're 60 feet underwater. The more pressure, the higher the dosage you're getting of oxygen. But in terms of who's doing it, we have it at my clinic. There's, you don't technically have to be a medical doctor to do it. You do if you're prescribing 100% oxygen. It's very interesting. Oxygen at 99% or less is a supplement. Oxygen at 100% is a drug. So at 100%, you have to have a medical doctor prescribing the oxygen, but anything below that, you can just get an oxygen concentrator for. And then there are people that are just getting them in their homes. You can just get a home chamber. It's pricey. You know, getting a chamber can be anywhere from $10,000 to $110,000, depending on the quality and the depth of chamber you want. And the treatments can be anywhere from, I think I see group ones now for $99 a session. Most of them are going to be close for like $200 a session. I know I had a question before the talk started about, you know, how many sessions I do. I can't find Monica and Chris, but they had asked me, well, how many sessions do I recommend? Because my patients are getting HBOT and neurofeedback and TMS and photobiomodulation, I usually recommend like 5 to 10 treatments to start, and let's check in. Some of my patients feel great after that, some of them need more. Just depends on the person. Any follow-up questions with that, or did I answer it okay?
Be good.
Okay, very good. Okay, so going back to the prefrontal cortex, why do I like this area so much? Because it's one of the most well-researched regions of the brain that are stimulated during transcranial magnetic stimulation for the alleviation of treatment-resistant depressive disorders. AKA, this is the area we light up when I'm trying to get my depressive patients to have hope again, to feel motivated again, to alleviate some of those depressive symptoms. It's not just that one area itself is like the area of depression. It does a lot of things, and it talks to a lot of regions of the brain. But there's been research to show that if you can activate the dorsolateral prefrontal cortex utilizing overlapping electromagnetic waves, which is what we do in TMS, that it can talk to these other regions of the brain to improve cognition, improve memory, and decrease signs of depression.